Are you advocate for wellness and health? Yes? Huh? Yes? Then you have the right panel and you are in the right booth. Let's start with you, Dr. Haddad. Welcome on board to our panelists, all of you.
Thank you very much, and good afternoon, everybody, and thank you for the opportunity.
With pleasure, the opportunity is for us. Dr. Haddad, as a bariatric surgeon and one of the experts in UAE and the world, are there any innovation for bariatric surgery? And is there any more for obesity management? Can you tell us more, please?
Thank you very much. Great question. We just talked earlier about precision medicine, and happily to say that with M42, with M42, we were the first people to use it, the first AI for medicine, and we are using it. So this is one of the great innovations that's helping us on day to day. If we include the AI and all the genomics, if we include all the data that we have right now, again, I will give an example just like what I did earlier. Right now, when we drive our cars, there is an auto drive that will help us. In the future,
most probably men know it more than women.
yes. So that auto drive will tell us a feedback when we are driving. If we are deviating from the lane, there will be a feedback. You still can override that, but you will know that you will not be doing what most of the people do. So now AI is going into the operating room and will tell the surgeon that if they do that move, 95% of the surgeon will not do that move. So he will know that this move is out of the norm. He will still can override it. He will still be able to do it, but he will know that this is not the normal. So this is one of the things which you're looking at, AI in the operating room. Regarding medications, I will leave it for my colleagues because there are lots of new medications that are coming to the market.
Thank you so much. You're happy with this technology, is it true?
Absolutely, absolutely. As I said earlier, it's a dream come true. We will have a map when we treat the patients. We previously used trial and error. We will use this medication and then we'll see if it works. If it doesn't work, we will add another medication or change it. And we do the same with surgery. It's $1 million question, which operation for which patient? If we use the AI, if we use the platforms of the information that we have, then maybe in the future we can tell the patient this operation is the best for you.
And the future is now, isn't it?
The future is here.
Thank you so much, Dr. Haddad. Your Excellency, Dr. Omniyat Al-Hajeri, welcome on board.
Thank you.
Thank you. My question to you, I think you will need 3 days, most probably, but let's try to have some insight through Abu Dhabi Public Health Center strategies for obesities. Give us some highlights, please.
Okay, this is realistically a 3 days question.
Yes, we'll come back.
Let me try and draw the bigger picture, as strategies always are. For this time, the combined strategy of DOH and ADPSC takes the real eagle's view. So we started looking from the beginning, causes of obesity in general, and we've mapped that to our interventions and what we can do, with a very important 2 pillars that we focused on that were not part of our previous strategies. One of them is the use of cognitive behavioral change in driving our interventions and driving our media and awareness campaigns. And the other thing is highlighting the fact that obesity is a disease and that people that require treatment should be classified appropriately and should have access to the treatment that they need and they deserve. This is a collaborative strategy that looks across governmental, non-governmental entities, with a lot of interventions that you will be seeing coming soon. We have more than 18 main initiatives with more than 74 sub-initiatives. The way to lead something like this is to ensure that your stakeholders and people that you're working with are much better than you, like we do with the colleagues here, and that each of them can take a torch and run with it to the best of the public in the Emirate of Abu Dhabi and in the UAE, and hopefully be able to exchange expertise and leave an impact and make a change, not only here, but also internationally.
That's an ambition plan. That's amazing. We're all here to support you.
Thank you.
Thank you so much. Dr. Sarah, obesity from science to solution. I can't have you on board and stage and not ask you about the clinical genomics and obesity. Can you tell us a little about it?
Of course, would be delighted. So, as Dr. Umniyat has said, Her Excellency Dr. Umniyat Al Hajri has said,
Can I ask you to have the mic?
Sorry, can you hear me now?
Yes.
Yeah. As Her Excellency Dr. Umniyat Al Hajri has said, obesity is a disease. It's a multifaceted disease, and therefore the genetic background to it is also, we're still understanding. We're very privileged to have the Emirati Genome Project here, and I'm sure we'll understand much more. What we know so far, we've learned from diseases where one gene is affected, so monogenic obesity, and that's taught us what the causes of obesity are. They are mainly in the brain, they're mainly related to hormonal changes. It's taught us what medications can be there. So for example, we now have 2 different medications which target obesity specifically in the affected person and work perhaps even better than bariatric surgery in these affected people. So the beauty of knowing what you're dealing with is, like Dr. Mohammed said, if you drive with your eyes closed, you won't get very far. But where our eyes are opening, we're understanding the bigger picture, and the future is here, and the future is genomics, the future is targeted precision medicine. The future is looking at the bigger picture, because we've learned from bariatric surgery, for example, that if you treat a woman with bariatric surgery, her children who are born before the bariatric surgery are more likely to get diabetes and obesity, whereas her children who are born after the bariatric surgery, when she is healthier, are very much less likely. And that's epigenetics, that's regulation of the genome, so that these children are born in a healthy environment, they have a healthy placenta. I mean, it's just so exciting. I could go on forever.
Looks amazing. I'm going to Your Excellency for an additional question. Dr. Haddad was speaking about AI. And Dr. Sarah was speaking about genomics. Okay, how are you integrating in Abu Dhabi Public Health Center both technologies?
Very useful question, because this is where we are actually going in the future. What we are looking for is personalized prevention. So I'm not even talking about precision medicine. The vision is to go towards personalized prevention. The more we know about the genetics, whether it's monogenic or multiple gene disease, and the more we know about artificial intelligence, the more we will be able to predict the future pathway and possibly intervene early enough to make sure that people do not have to go through the whole process to be treated. There are golden opportunities in the human's life. We've all noted that it's much easier to change and have the drive to change and achieve what you want when you start at a much younger age. It gets more difficult as you grow older, because your lifestyle, your choices become ingrained in you. And the changes in the environment are very important. We cannot underestimate the importance of utilizing the new technologies to the maximum for a very simple reason. Then you will be able to offer the best prevention intervention for the person, or the best treatment intervention for the person, not only based on him reaching the disease stage, but you'll be able to model, you will be able to foresee, you will be able to assess. Now, this package comes with a lot of ethical questions that needs to be discussed openly in the public with the people, because for us, from public health perspective, humans are the real driver and they are the real target. The public and what is the best for them, they have to have a very strong say in it. We see that the revolution is going to come from communicating properly with our audience. They should be able to inform the strategies. They should be able to inform the way forward and how much we go in line of digging further into the genetics, because it's going to be available anyway. And how
Absolutely.
far are we going to go with artificial intelligence? There is so much. My own personal dream was actually to have your digital twin, and maybe he can go through all the difficult parts, I go through the easy ones. I've always wanted a digital companion for my kids when I'm not at home that I can trust 100%. So I come shaded with the fact that I love imagining the best for people, but that sometimes take you to a direction that maybe not what everybody else wants. And I think listening is the key for the future.
Absolutely. I share your dream. I like it. We have a nice team here. Let's have a wish list for them. That's amazing. Thank you. Dr. Haddad, the integration that is tackled by Her Excellency, okay, how are you putting it in practice, okay, between you as a surgeon, Sarah as endocrinologist, and also consulting for gynecology and the public health? Give us some examples for this collaboration.
Thank you very much. And the best is to go with the examples from real life. So if we talk about individual level, so when I see a patient, for example, in the clinic, especially when we see kids with obesity, the first thing we want to know if these kids, they have a monogenic obesity. So we send these patients for Dr. Sarah, because she is specialist in genetics, not only endocrinologist, to make sure that this patient, we will be treating that patient with the right tool. So if this patient has a leptin deficiency or POMC deficiency, there is no benefit of doing the surgery. The surgery won't work with these patients. We need to fix that problem. Maybe in the future they will need the surgery. So that's one of the things. That's what the Emirati Genome Project comes in hand. That's one thing. We asked about the AI, M42. One of the examples that M42 launched late in October, and we are using it very successfully and helping us with the patient. And I mentioned the example earlier, and for those who were not here, we had a patient, that shared patient between me and Dr. Sarah with BRCA1 deficiency, which is a very rare disease. And we didn't know whether this patient should go and have bariatric surgery first, or she should go and have a hysterectomy first, because they are liable for breast and uterine cancer, as well as obesity will increase that risk. So we used MET42 to look at Maleffi, which is one of other projects or other of M42, and actually MET42 told us this is a very rare disease. There is not many literatures about it, but here are my thoughts. And we looked at these thoughts, we discussed them, and we chose what's best for the patient. And actually the recommendation was valid.
Amazing.
And that patient had surgery last week.
That's a dream.
So this is just an example. Now, if we include to the collaboration that we were in the panel earlier, that MET42 gave us the Maleffi, the history, and a little bit of the literatures. But if we put all the data, include the genomics, with the imaging, with the microbiome, as I said earlier, the two-dimensional picture will be 3D picture.
Amazing.
And this patient will be able to tell the patient exactly where we will start, what do we expect, and what will be the results. And this will help us to be targeted medicine, precision medicine. Now, there is one benefit for all of this. If we do that frequently, then we will be able to go back to Her Excellency and tell her, we looked at this certain group of patients and they have this certain problem, and we need to work on that from public health.
Amazing.
The other dimension for this is sustainability. If we go and treat the patient with the medications that we know from the beginning that it will work, then we will save that patient using multiple medications. If we know that this patient, the best operation for this patient, X patient, is this operation, then we will not expose the patient to 2 operations or 3 operations, and we will use less resources and will be more eco-friendly and more sustainability. So the limit is the sky.
Amazing. The limit is the sky. Let's go down. Okay, Dr. Sarah, before going back to the sky. The impact of this collaboration on patient experience, How do you see it?
It's a fantastic effect. I am blessed to have a colleague like Mohammed Haddad. I'm blessed to have a colleague like Mohammed Haddad. It's an awesome setup. We have a multidisciplinary team which has over 15 physicians in it. We discuss patients. The brains of 15 people are certainly more than the brains of one. We have open access to each other's clinics, so if a patient comes in and they need bariatric surgery, they're able to see Dr. Haddad on the same day. Similarly, if there is someone who struggles with anything really, poorly controlled diabetes, needs medical therapy, then we have an open access at the same day. We see all the post-operative patients with diabetes before they're discharged. I think our patient experience is very good as a team, but more importantly, we feel it is a family. Every person who comes in to have treatment, be it medical, be it surgical, be it dietary, is part of our family. They join the MDT. Obesity is a disease. It's a lifelong disease. We are committed to make the journey one that we all hold hands along.
That's amazing. Thank you, Dr. Sarah.
I should add one more thing. What we're blessed to do is that between Mohammed and I, most of the time we look after individual patients. What Her Excellency Dr. Omniyat Al-Hajri has allowed us to do is to share in making this a public thing. So we're trying to share the knowledge that we have, and we have had amazing support to try and push the agenda for obesity. And thank you very much. You've been a fantastic collaborator.
Your Excellency, Dr. Omniyat, as Dr. Sarah in a right way tackled the patient experience, but on an individual basis, okay? What's your wish and where is the bar for Abu Dhabi Public Health Center with this integration, the clinical side, AI and genomics? Where do you want to go? What is the definition of the sky?
See, I would love to use a cliche like the sky is the limits, but the fact is we have clear targets that we want to reach.
Agree.
So what we need to be is to be among the top best in managing, tackling, preventing obesity. There will always be the challenge of, challenging ourselves to the limits and then moving forward. My job starts way before Dr. Sarah and Dr. Haddad needs to see the patients. And we should be able to reduce their workload as much as possible and use all their amazing expertise in guiding us to actually reach out to people that need the treatment and deserve the treatment. However, we need to start as early as possible. We need to put mobile KPIs to move towards. So once we reach a target, we need to push the border a little bit further. And we need to be able to address challenges, mistakes, and take a stand to move forward around them. Science will continue to change. Obesity as a disease will continue to evolve. And the possibility of using not just cognitive behavioral changes to influence decisions of communities and mobilize them into a better, healthy lifestyle is also going to be an evolving science that we will see a lot of it on the ground. So do we have targets? We have targets. Are those what I want? Those are what I want to reach within 3 years. And then we will have a second talk. We need to review, reassess, readdress, and that's where people that are much better than me in the field with a huge expertise can be the eagle's eye that tells me what I don't see, being so focused in my direction. We are here to aid each other. I keep saying it's more like give the strongest person the thing that he can do best. And that's the only way you can move forward as a group. And that's what public health is here to ensure that is happening. Create opportunities, allow colleagues to execute to the maximum, reach new horizons, and be guided and be humbled by their amazing expertise. Thank you.
Thank you so much. Collaboration, care and innovation. That's an amazing panel today. Thank you so much. I want to open the discussion with our attendants. Some question, please. Yes?
Thank you. Thank you very much. I'm really enjoy. I'm Azam Kayase from Dubai. I'm gastroenterologist and clinical microbiologist. Thank you, Dr. Haddad. You mentioned about microbiome. You know, as Her Excellency said, we should take care as prevention. If we start to take care of the microbiome signature of the first 1,000 days of life, you will have a baby or you have a children without obesity. How we can add, in addition to UAE genetic project, UAE microbiome project, which is my dream. I want to hear from you. Thank you, Fatima.
Thank you. So the beauty of being a part of G42 is that it's multi-omics. It's not just genomics. So they're looking at genomics, they're looking at epigenomics, they're looking at proteomics, and they are looking at the microbiome. So it's already happening. Not the whole 500,000 samples have microbiome, but it's happening. It's a very interesting point that you've put, that babies will not have obesity, but the microbiome, as you know, is altered by many, many things. And the environment for a baby when they're first born is very different to your and my environment. The beauty of microbiome is you would be able to look at signals that change. And I think you do need a control. You do need someone who is the same age but different weight, the same sex but different weight, to control for other things. Otherwise, it becomes difficult to interpret. But it's an excellent idea.
The most important, we should work all together about the clinical transnational microbiome platform. If we found this one, it will be easy for the doctor, it will be easy for the patient, it will be easy for Her Excellency to do a project. Thank you.
Thank you very much.
Hi everyone, that was a great presentation. Thank you so much, and it's really great to see that proteomics, genomics, epigenetics are all included in the wholesome approach of solving these problems. I was wondering from a different perspective. So, pharmaceutical companies, they design drugs according to the samples that they get from different parts of the world. But I'm wondering, is there a representation of the UAE population within these, say, basic research within pharmaceutical companies at the moment?
I think I can start and then give it to Dr. Sarah to carry over, because I think we'll be touching on the same basis. We are relatively underrepresented in all research, not only this particular research. But when it comes to obesity medication, there is a huge drive from the government to initiate our own researches and find out local data on people that have utilized the medication. We do recognize that we don't have enough information reflecting specifically the population within UAE. But I also have great confidence that there are many other countries that have almost a similar nationality mix. In Abu Dhabi, we take pride in having more than 200 nationalities. So when we talk about cultural selectiveness, I think we can relate and link to other countries that have multiple nationalities residing and living for so many years. But we definitely ask and drive and looking forward to enable our colleagues to produce our local data.
Thank you for that question. So regarding the genomics, I saw earlier today a lady from the Broad Institute, and many of the international genome projects deposit their data centrally so that it can be analyzed across different backgrounds. Are we there yet? I think things will happen. I'm not speaking for anyone I don't know, but at the moment we're still at the stage where so much has happened so quickly. The Emirati Genome Project is the fastest and one of the largest genome projects in the world. The wealth of data inside it is stunning. I think people need to reflect internally and analyze what they have before they start comparing to other areas.
Thank you so much for our speakers. Thank you for being advocate for health, for being advocate for wellness. Let's end the session on thinking health, not only healthcare, prevention, not only cure, and let's go with innovation who is meeting care. Thank you so much. دكتور حداد يعطيك العافية.